Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome back Matthew Balish. Thanks again for coming in.
You're quite welcome, Mary.
You are a pharmacist with Apple Drugs.
Yes.
And we have had a passing of late where you mentioned that you were doing a lot of work and research on the topic of cannabidiol.
Yes.
Or CBD, we'll call it.
Yes, CBD is a nice abbreviation.
It's a very hot topic right now.
It is.
So I know our viewers will want to hear more about it because we're seeing it pop up everywhere.
Yes.
So tell us about it. What is CBD and where does it relate to in terms of hemp? And
sure.
Take it away.
CBD is found in both the hemp plant and the cannabis species that are used for marijuana. The big difference is the hemp plant doesn't have the THC, minuscule amounts, 0.3%. Hemp was actually very big in agriculture in the United States up until about the 1940s when it was phased out, and now it's coming back. And the hemp plant produces 10, 15 times more CBD than does the cannabis strain used for marijuana. So it's a great source of CBD. CBD itself is a cannabinoid, and a cannabinoid is a substance that's made by plants, including the black pepper plant. The echinacea plant produces cannabinoids. Our body actually produces endogenous cannabinoids, so you can use plant cannabinoids to supplement that. It was originally discovered in the 1940s and thought to be pharmaceutically inactive, and it just sat on a shelf for many, many years until probably the early 90s when they figured out we have this whole signaling system in the body, and they found that it was involved with the signaling, the endocannabinoid system. You could do a whole show on that. It's very explosive. There's lots of neat stuff there.
So how does it exactly work in the body then? Okay,
so cannabidiol or CBD from hemp supplements your natural production of the endogenous cannabinoids, the things that your body makes naturally that we make a little bit of. So it's very individual. I may make more endogenous cannabinoids than you, but we can both utilize CBD from hemp to supplement that and get positive benefits. It's kind of like taking a vitamin supplement. You're boosting your levels of that in your body so you have more of it. And what it does is it helps with pain, it helps with inflammation. It's very much involved in regulating sleep-wake cycle, attitude, depression, happiness. The actual CBD molecule in the body, its closest analogous, is called anandamide or the bliss molecule, because most people, when you supplement it, they get happier. So it works well for mild depression. I'm not saying don't stop taking your drugs.
Right.
I'm just saying that people that use it are less blue, let us say. We're finding that CBD in the body works very much like thyroid hormone. It works on everything. So it will modulate or manipulate your immune system. So it'll reduce inflammation in the body. So that means it's great for people that have arthritis, inflammatory conditions like rheumatoid arthritis, Crohn's. There may be benefits there. It's involved in the motor cortex in the brain, so there's a lot of questions on whether it's beneficial for Parkinson's disease. There's some evidence for MS and the spastic disorders that supplementing CBD can help that. So there's a whole list of 8 or 9 indications that you can potentially use CBD for.
Well, just to be clear, let's differentiate then between, people are hearing a lot of news about medical marijuana where the component there, the active ingredient there is THC.
Well, yes, there is THC, but there's also a whole raft of CBD components in the medical cannabis. The big difference in what I like to tell people is when you're getting CBD from hemp, you don't have to worry about the side effects of the THC. THC can cause mental drowsiness, heart palpitations, things like that. CBD doesn't. And so I like to tell people, look at CBD before you would consider medical cannabis, because you can get benefits in that realm, and that would be a whole other discussion. But the CBD alone from the hemp plant, you don't have to worry about the side effects. There's actually evidence that suggests CBD helps prevent the side effects from THC in certain quantities. It can be very confusing. And what I tell people that come into the pharmacy is you have to be careful what you read online, because there's an enormous amount of information and a lot of it is anecdotal. A lot of it is my girlfriend's brother's father tried this and it worked and we should use it. And you have to really be careful with that sort of thing. We also suggest that you be very careful and talk to your doctor and pharmacist, because there are actual drug interactions that can happen with CBD and medical cannabis. For our discussion, we'll focus on the CBD. And when you come into the pharmacy, we have you talk to our pharmacist to screen you for those. So for example, if you're on a blood thinner like warfarin or Xarelto or Eliquis or Plavix, we're going to send you back to your cardiologist, because CBD can actually prevent those drugs from being metabolized, and you could have a bleeding problem. So we don't just sell it to you outright, and we don't recommend you buy it from the internet, the gas station, the vape shop, or another outlet where you don't have a medical professional giving you guidance.
Yeah, you've seen it pop up everywhere now.
You are. You can find it in skin creams, balms, lotions. You can find it in vape pens. You can find it in gel capsules. You can get it on Amazon. It's all over the place. You can also, let me back up. The other thing you're going to see is the CBD kitchen sink effect, I like to call it, where they take CBD and they combined it with capsaicin or other herbs, I call it herbs and spices, where they throw like melatonin in or capsaicin or some other herbal supplement to give it extra kick. Based on the research and the reading that I've done, CBD on its own, you don't need the extra herbs and spices. It should give you benefit without that. So I tell people, look for a pure product, look for one that has available certificate of analysis. They have to prove what's in there. And you want to look for full spectrum hemp. So that means you get the CBD plus all the 80 or 90 other beneficial cannabinoids that we're still learning about from the hemp plant. It's also called the CBD entourage effect, because you're getting the CBD plus the other hemp cannabinoids, and we think that there's some synergy there and that it's helpful.
Now, like herbs and spices and
Yes.
supplements that you're mentioning, these are not overseen by the FDA.
They are not. Currently, the CBD market is the Wild West. Any company can pretty much sell it because of the Agriculture Act, the U.S. Congress Agricultural Act of 2014 legalized it, so they can grow it and produce it from agricultural hemp. And after that, it is wide open. Companies can buy the oil, put it into whatever products they want, and that makes it very difficult to find a quality product, a product with good recommendations. The other thing you want to look out for is products that are tested for fungicides, pesticides, bacteria, salmonella, all of those bad things that could come from an agricultural product. So we like to tell people, do your research, do your homework, don't just take the company at face value. Try to find a legitimate product. The other issue, the American Journal, the AMA Journal, JAMA, did a small study 2 years ago where they bought 85 CBD products off online. They just went out and bought them. And they found that 3/4 of them had more CBD in them than they thought. Half of them had more THC than what was on the label. And another third of them were underlabeled or overlabeled. They didn't have enough in there. So you really have to be careful.
So what again is the limit of THC?
The limit of THC by law for it to be a hemp product is 0.3%.
So that still would have no effect.
Correct. You could drink a whole bottle of it and it would not show up and give you those THC effects, the high, the palpitations, the dry, all of the stuff that goes along with cannabis use.
But you would have some side effects, because there are side effects to CBD?
Surprisingly, no.
Okay.
There are
But
not
you
as
said if you drank a whole bottle, perhaps.
Yeah, okay, so
but
yes.
no one would do that. So I guess let's talk about the dosing. Or
Okay.
maybe someone would. I don't know. But let's
So,
talk about the dosing.
Sure,
and
the
effect.
dosing. The dosing is very individualized.
Okay.
If you look at the medical cannabis realm, they use much higher doses than what is typically recommended in an over-the-counter product. An over-the-counter product, you can go from 2.5 milligrams a day up to about 50 in that range, and you should find some benefit. Some people need more, some people need less. I tell people, if you need 10 milligrams, why should you waste the 20 milligram dose? Use the dose that you need. And that may change over time as, your conditions change, prescription regimens change. But most people, once you find a consistent dose, it's pretty stable. So for example, I have a gentleman who comes into the pharmacy every couple months and buys it. He's doing 20 milligrams a day, and he went from taking an aspirin, Excedrin, and 3 ibuprofen 800s a day down to an aspirin and 1 ibuprofen 800 a day, pretty consistently. That's the other thing that people need to think about is CBD is not going to be 100% all the time. You're going to get a benefit, but there's going to be more variability in it. You may have, so if you have rheumatoid arthritis, and let's say before you started CBD, you have 20 good days a month, and you have 10 where you're really hurting, you may go down to 5. But that's going to vary a little bit.
So you still may need some other meds
Correct.
to go along with the CBD. It's a supplement that may reduce the dosing. Or
Exactly.
The other.
So for people, for example, with diabetic neuropathy, nerve pain is another thing that people look at CBD for. We tell our patients when they come in, 7 out of 10 people get some form of benefit. Don't stop your meds cold turkey, because this isn't a 100% replacement. So if you were taking 4 gabapentins a day, you might get down to 1 or 2. But you still may have a bad day where you need 3. It's very rare for you to use a hemp-based CBD product to replace a prescription medication. It will supplement it, but if you are lucky enough that you can have that replacement effect, I would consider you an outlier. But 7 out of 10 people that try it find some form of relief. They sleep better, they have reduced pain, they have reduced nerve pain, they may have an increase in appetite if that's what they're looking for, anxiety is reduced, all sorts of wonderful things can happen when you supplement this in your diet.
But you should check with your physician first, correct?
Well, I say check with your pharmacist
or
first.
Or a pharmacist, okay.
A lot of physicians are recommending CBD, and I'm, in my experience, at least locally, the doctor will recommend CBD, and then they'll tell them, go talk to your pharmacist. And that's a great synergy, because we'll look at their prescriptions, and at Apple, if you're on blood thinners or anti-epileptic meds, we send you back to your doctor to discuss it before we sell it to you, because those are the two big classes of drugs that you can have problems with.
Now, it is FDA approved for one or two indications.
Yes. So there is an FDA approved product called Epidiolex. It's made by GW Pharmaceuticals. It was approved in 2017. It is a Schedule 5 drug, so it is more restricted according to the DEA. And it is 100% hemp oil, 100 milligrams per ml, and it's about $1,200 a bottle. And it is only approved label-wise or government-wise for two conditions. That's your Lennox-Gastaut epileptic syndrome and your Dravet syndrome, both childhood seizure disorders that are very hard to control. I have never actually seen it come through the pharmacy yet, although it is available at my wholesaler, nor have I seen a prescription for that particular product. And that product uses doses that are much higher. You're talking 100, 200 milligrams a day to control seizures, where most people that come in and buy it for supplemental use, you're between 2.5 and 50. Now, that being said, CBD is very safe. If you looked at the GW Pharmaceutical data, they gave people mega doses of CBD, and there was very little physiological effect that is negative. Drowsiness, dry mouth. In some rare instances, lower blood pressure is reported, but that could be related to the anti-anxiety effect. That's the other thing. We are still learning about how cannabinoids function in the body. We're still learning about the endogenous ones that we make, and it's a developing field. But it's one that I've had elderly people ask to use it for aches and pains. I've had mothers come in and ask me about it for kids on the autism spectrum. I've had pediatricians call me and ask me questions about it. All sorts of conditions can potentially benefit from it, but I think you have to use good judgment and get it from a reputable source and really talk to your pharmacist about where you're getting it, and so that they can guide you towards a safe product, because you want to have a good experience and a benefit from it.
Now, if someone would go to a pharmacy, you would buy it, it comes in a bottle with a dropper that has measurements on it by milliliter? Or?
Yes. So depending on the product that the pharmacy is carrying, this is where you have another hurdle to jump over. Some products are dosed by the drop. Some products are dosed by the full dropper. Others are dosed by quarter, half, 3/4 milliliter oil. And we should let people know that when we talk about the oil is a sublingual oil, so it goes under your tongue, and that way you get the maximal benefit. If you swallow CBD capsules or gummies, you lose half to 3/4 of the CBD before you get any benefit, because your liver filters it out. So I tell people that's the last way you should use CBD is orally, unless you don't have any other choice. My biggest recommendation is under the tongue at bedtime, because it will make you drowsy, and it will help you sleep. So a lot of people that come in looking for the Benadryl to help them sleep, you could very easily replace that with CBD oil.
Of course, this costs a bit more than Benadryl,
It does, but it's in a lot of ways it's very much safer, because you don't have the anticholinergic effects that make you woozy and make you prone to falls.
Right. So especially for older adults.
Yes, it is. Yep.
So how much does it cost then? You buy it in a small bottle?
You can buy it in a small bottle. CBD oil has a wide price range. You can get very inexpensive CBD oil products online that are questionable about the amount of CBD that's actually in them. The products that we carry at Apple, we have a salve that's $29 that's good for local joint pain. We have a sublingual or under the tongue oil. Our smallest bottle, that's a month's supply, is $49, and our largest bottle is $1.99, but it's a much larger bottle. Generally, you're looking at between $60 and $100 a month, depending on the company, what's in there. The vaping solutions, I don't know how much they cost. I typically don't recommend the vaping. So yeah, there is a cost associated with it, and unfortunately, it's just like buying vitamins. You just have to purchase it.
So will we see more research then, now that the use is becoming more mainstream?
I think you are. I think
so
you're
we
going
can
to
find out more about it and the benefits and so forth?
I think you're going to see a lot more research and a lot more studies. I think Epidiolex is going to be the first of a wave of prescription products.
And that's the one for the seizures in children.
Correct.
Okay.
You know, I think CBD oil is safe if it's from a hemp plant. I think it's effective for helping reduce pain, inflammation, sleep, anxiety. Some of the other indications are less clear. I haven't run into someone that I've completely said, no, you shouldn't use it, but you have to do your research. The safety component is very important. You need to talk to your doctor, you need to talk to your pharmacist, and you need to screen for drug-drug interactions, because unlike taking a multivitamin, this gets metabolized by your body and it can cause some drug-drug issues. For example, the blood thinners are the big one. We don't want people having
that is a big one, the drug
bleeding gums, nosebleeds, because it will compete.
So again, to emphasize, or it sounds like you're saying there's clear indications for it. It is not something people should just take because it's the popular thing to do right now, it seems. It's very, you know, you're just hearing so much about it. It's good for this, it's good for that. So people should be very careful and speak with their doctor or pharmacist and make sure there's an appropriate indication for it. Number one, it seems expensive, so, and number two, you should have an indication for it, correct?
Very much correct. You need to approach this like you would approach adding any medication or supplement to your regimen. You have to have a reason to use it, as you said, pain, anxiety, sleep. You have to talk to your doctor about it to make sure that they're on board with it. You have to talk to your pharmacist to make sure there are no drug-drug interactions. This is not a product I would say you would buy at your convenience store and just try. You want to have a much more measured, careful approach. Ask questions. You can stop in to any of the local pharmacies that are selling it, and I'm sure they would talk to you about the pros and the cons. But you most definitely, and you're right, it's not inexpensive, but it does have its benefits.
Well, thank you so much, Matthew, for enlightening us on this.
You're welcome.
I know I've been hearing a lot about it, and it's just nice to sit down and just get an overview. It's very helpful, and I'm sure our viewers will appreciate it.
You know, I would tell you, thank you for having me again. I would tell your viewers, do your homework, ask a lot of questions, and until you are sure, don't buy anything.
Okay, very good. And I know you will post some websites you recommend at the end of the program.
There are some recommended websites. You can come in and talk to me at Apple Drug Monday through Friday. I'll be glad to answer your questions.
Okay, terrific. So thank you again for coming in
You're
and
welcome.
enlightening us on this topic. It's very intriguing, and I'm sure there'll be much more to come on it.
Yes.
And thank you for joining us for this edition of Focus on Health here on PAC 14.